we're going to talk about interactive complexity. This is a code that people ask all the time about how to use it. One of our Bill Like a Boss members asked this question today, and I wanted to just do a quick presentation to walk through this because interactive complexity is one of those codes that people ask about all the time. It's code 90785, interactive complexity, and it's an add-on code. So a lot of people get confused about whether they can use it or not. People tell me they're using it all the time, and sometimes I'm like, I don't think you can use it for that. So this isn't where I'm going to be judging whether you can use it or not. I just want to talk about what it is and give you some insights and some ideas about it. So documenting the use of interactive complexity requires careful and detailed notation in the client's record to justify the additional complexity during the session. So here's some guidelines for this. First of all, you could go look up the CPT code. I could read it to you. It definitely has some specific criteria, and I do encourage anyone that's thinking about even using that code to go over, read the code, Google it, read the code, and think, does this session I just have really fit into this code? The key factor of 90785 is the presence of specific communication barriers or other complexities that require additional effort and skill by the therapist, because it is open to interpretation. Like I said, it's an add-on code. You can use it in conjunction with other psychotherapy codes. Our Bill Like a Boss member, asked some specific questions. So clients with small children. So an example, if a client brings a small child into the session and requires a lot of attention and it's getting significantly more complicated because the therapist is trying to provide therapy, but also deal with the kid, would a 90785 be appropriate for this? So yes, it would. If you go read the code and interpret it, yes, this would be an appropriate use for the code because the therapist has to integrate the care of the child into the session. So it really does impact the dynamics and the approach of the therapy session. It makes it more complicated. So I say yes. There will be people that will say no. Again, this is up to your interpretation. You can always call the insurance company and say, this is what happened. Can I use this add-on code? Document who you talk to, and hopefully they will guide you through this process a little bit too. Usually provider relations, your provider rep, somebody like that might be able to help you with guidance around this. A lot of times they'll say, we can't tell you how to bill, but it's worth a try anyway. Another situation she asked about dissociation with clients. So when working with clients who frequently dissociate in a session, this can indeed add complexity to the session. So the therapist may need to employ additional techniques or spend extra time reorienting or engaging the client to the session. So definitely if somebody's completely dissociated in a session, it's not your typical session. It's going to involve more interactive complexity. You know, you might have to help them down on the floor. You might have to really work on grounding. You might have to cancel your next session if you can't bring this client back all the way. So it's definitely a complicated psychotherapeutic technique that would justify the use of 90785, in my opinion. Again, my opinion. Don't take this as gospel, please. This is just me interpreting in my own perspective what I think about these. Another thing she asked me about was clients with BPD showing resistance, agitation. So that's borderline personality disorder. Clients who exhibit significant resistance or agitation during sessions can also warrant the use of 90785. So there you have it. I mean, I don't know what you guys think about this, but if somebody's really agitated, it's getting hostile in there, it's getting really emotionally escalated, that could definitely complicate the therapy process. So in this situation, I believe that this code would be appropriate if you wanted to use it. My interpretation again. It's essential to document these complexities in the client's record to justify the use of this code. I'm going to talk about that in a minute, but just putting this out there, another thing she asked me was, what about EMDR? I hear that EMDR therapists use this code. So my interpretation of that is if you're using a light bar with EMDR, or if you're a telehealth therapist and you're using like extra technology to help facilitate an EMDR session, I would say yes, that you could use this code. Sometimes people tell me that they use it, that they always use it for couples therapy, which I feel like that's a gray area. I feel like all of these are gray areas, but that's definitely one I'm like, okay, I don't know. Somebody told me they bill it every single time for every single couple session or marriage counseling session, and they get paid for it. So, you know, this is up to your interpretation of how you want to build this code. Documentation example. So I just want to talk about the fact that if you're going to use this code, you have to make sure you're documenting it really carefully. All right, clients bringing small children. How do we want to document that? Note the presence of the child and how it impacts the session. You want to document that. The child was there and it made the session more complicated. Describe the efforts made by managing the therapy environment due to the child's presence. Clinician was distracted, had to constantly leave the room to get water or take the child to the bathroom or whatever. Explain how the child's presence affected the communication dynamics and therapeutic process. Mother had a difficult time concentrating on topics discussed in session, blah, blah, blah. You could say something like that. For clients who dissociate, here's some options you could do. Document the instances of dissociation during the session. Client seemed present and alert, and then all of a sudden was unresponsive, something like that. Dissociated for at least 20 minutes during the session. Clinician handled it using these therapeutic techniques. And right here, describe the additional therapeutic techniques or approaches you use to re-engage that client to bring them back to the present. Documenting instances of dissociation during the session. Extra time or effort required to manage these episodes and maintain therapeutic engagement. So you want to document that too. Clients with BPD showing resistance, agitation. Talk about that. Record specific incidences of the resistance or agitation. So client got up, threw a chair across the room, totally out of character for her, and we had to pick up the furniture together, something like that. Describe how the behavior complicated the therapy session. Clearly that complicates it when you're having to pick up broken furniture or something like that. Note the modifications in your therapeutic approach to manage these behaviors effectively. So definitely documenting all this, super important, because if you get audited, you're going to want to make sure you've documented why you use that code. It's very important. Any code you're using like that, an add-on, you have to document why. For all of these scenarios, follow these general principles for documentation. Clearly describe the complexity and why it necessitates additional management or therapeutic skill. Vague statements are not going to be sufficient in this situation. Explain how the complexity impacted the therapy session. Frequency and duration, record how often the complexities occurred and the duration within the session. Therapeutic response, describe your specific therapeutic interventions or modifications in response to these complexities. So I think that's important to talk about the evidence-based treatment modalities you use to bring them back, grounding techniques, mindfulness intervention, redirecting client due to child constant interruptions or something like that. And like I was saying, in case of an audit, the detailed notes will really demonstrate the necessity of the 90785 being an add-on code. They should paint a clear picture of the complexities encountered and the additional efforts made to provide effective therapy under these circumstances. So I hope that helps. Let me know if you have any questions. For those of you that are watching this that are not Bill Like a Boss members, join Bill Like a Boss for more help like this. Anytime you ask questions, I'm going to do everything I can to give you a presentation about it, to thoroughly research your topic and try to help you understand it better. Here's a QR code. If you take a picture, you can get taken right to the homepage of Bill Like a Boss. And here's my email if you want to reach out, info@kimtolson.com.